not surprising that homeopathy spread over almost the entire world. It's still very active in many countries, Mexico, South America, India, Africa, and so on, in the sense that there are recognized practitioners, and you go to a pharmacy and the remedies are available in almost all pharmacies and so on. This country is a little bit different in that regard. Each country has its own history. So I'm going to go over what happened here in this country with you, so you at least have an idea of the historical background of it. It began with a fellow named Hans Birch Graham, who actually was born in New Jersey, but from immigrant parents, but went back to Europe, and he born in Boston, excuse me, and he was educated in Europe, and then he had a practice there until he was about 40, and was very successful in his practice with the medicine he'd been taught in school. And in 1825, he brought homeopathy to the United States. He had learned in 1823, he learned about homeopathic medicine from a Dr. Lund, who had studied directly with Samuel Hahnemann. And so Dr. Graham tested it, found it to be very useful in his practice, and began to use it. In 1824, he comes back to the U.S., opens a practice in New York City. So he was the very first practitioner in this country. He was in 1829 elected president of the New York Medical and Philosophical Society, and I'm only showing you these things just so you know a little bit about the background of the people involved in this, that they were doctors. They weren't necessarily flakes that were emerging from strange cults or something, but they were actual doctors in medicine that were learning and using this. It spread from his work because his fellow doctors that he treated recovered their health, and they became interested and began to study and use it as well, and it began to then develop and spread. The medical society, in fact, it was recognized as a useful method, so much so that the Medical Society of the County of New York made Samuel Hahnemann, the founder of homeopathy, an honorary member in 1832. Hahnemann himself died in 1843, so he was still alive at that time. But one of the, not surprising, though you may not quite have experienced this yourselves yet since you're still in school, but when you get into the profession, you'll find that there is, shall we say, competition. And it wasn't any different then. And so one of the things that happened as homeopathy developed is that it tended to attract the patients that were most wealthy, that were more educated and had more money to spend. And this made the other doctors jealous of the kind of practice that was developing for the homeopaths. So they began to be hostile to it and make fun of it. Not because it didn't work, but because of the competition that was there. But nonetheless, it spread, and homeopathy spread to New England and then to the mid-Atlantic and then the southern states and to the Midwest and so on over time, over decades. So mind you, he brought this around 1825 is when it was introduced here. 1851, the nation's population, the U.S. population, was a little over 23 million, with over 40,000 doctors. And of those 40,000 some doctors, 600 of them were homeopathic practitioners. That was 1.5% of the total. By 1901, then, another 50 years, the population in the U.S. had increased to 76 million, and there were a total of over 123,000 physicians, and not quite 10,000 of them are now homeopaths, so that was 7.8% of the total. So you can see that homeopathy was developing and growing, but not in huge numbers at this point. So I want to talk to you about why did it spread? You know, what were the reasons for it? You'll hear people give different explanations for it, you know, as sort of like a a placebo method, or it was less toxic than the other treatments and so on. But actually, if you look at the history, the reason it spread was the results that they saw in actual clinical practice. And I thought at this point I would give you one anecdote of that, and I also have a case, an animal case, to give you to show you the results that are striking. Last time in the first session, we talked about a horse case that had been injured. You saw the horse recover with just homeopathic treatment. And I'm going to show you a similar one here for a mule. And then I had a little video here. I was thinking maybe I could show, but I'm not sure that this service will let me show videos, and I was going to practice it. But we'll skip that because I'm not going to take time to try to make it work. And then the last thing I'm going to cover is the effect of homeopathic treatment during epidemics, because that was a very important factor in the development and spread of homeopathy. So I'm going to go over to this anecdote, and this is typical of what the doctors were experiencing that were exposed to homeopathy at that time. In other words, they knew nothing about it, and they would come up against it in some way, either being treated themselves or perhaps having a patient that they were dealing with another doctor recover rather dramatically. And so they were then impressed by that, not surprisingly. And so I'm going to give you that example here. What was said by a Dr. McManus in 1837. He was the very first homeopath in Maryland. And here's his explanation of how he was exposed to this and how he was convinced it was useful to study. So he says, I saw an announcement in a paper of a homeopathic physician by the name of Radcliffe. And at that time, I had a very singular case, and I did not know what to do with it. Singular is not a term we use so much, really. We don't use it now. But at that time, what it meant is sort of like unusual or extraordinary. It was a case that I defined to be neuralgia, that is nerve pain, rheumatic pain, or rheumatism. And the neuralgia was what he called intermittent neuralgia. That was, it would come and go for periods of time. His patient was a woman 19 years of age. He says very sensitive in her organization and nervous system. I know the language is a little bit old, but mind you, this is 1837, so this is the way they talked and wrote at that time. Every day at 2 o'clock, she was taken with what she called a needle pain. She felt as if a needle were stuck into her heart, and that was immediately followed by a convulsion, which lasted anywhere from 30 minutes to 2 to 3 hours. Now, you can imagine she's having this every day for weeks at 2 o'clock. You can imagine sitting there having a breakfast and thinking, well, I've got a few hours until my seizure. So it was a terrible experience for her. So this fellow, Dr. McManus, practicing the medicine of the time, he said he commenced the treatment with this plan, what they call tonic, in other words, to stimulate her body to be strengthened, to use sulfate of quinine. But still, the pain came on at 2 o'clock. It made no difference. Then he resorts to another treatment with using arnica. We talked about arnica last time. But this was not a homeopathic preparation. This was an herbal preparation. And then he used mustard plasters, front and back, applied to the heart. Anyway, the thing is that it didn't help. It didn't make any difference for the patient. And he says, I did not know what to do. I saw this advertisement and I said, I do not know Dr. Radcliffe. Nobody can tell me who he is. I will go see him. I went and told him the object of my visit. I asked if he had ever treated such a case, and he said no. He was a very intelligent man and very agreeable in his presence, bearing a conversation. He listened to my story patiently, and after hearing my case, he said, Doctor, I think a dose of spigelia in the 30th will cure that case. Well, this is not familiar to you. Spigelia is a homeopathic remedy, and 30th we refer to the potency, what we call the potency, how it was made, a 30C potency. So he was recommending, he recognized a homeopathic remedy that he felt was needed for this patient. All of the homeopathic remedies are in Latin names. That was the tradition 200 years ago and has continued since. So even though there might be a plant or an herb or something that's known to us by a common name, still most often it's used as a Latin name. So Spigelia is that way. So he says, 1 dose of Spigelia, said I. You do not mean a Maryland pink root. Yes, he replied, I will give you a dose. It was then 10 o'clock in the morning. What will I do with it, said I. His reply was, you put this powder on the tongue of the patient. I saw him pour out the pellets in a little sugar of milk. I had the curiosity to take up the bottle. It bore the mark, Spigelia 30. I left the house and thought to myself, this man must be a fool. And yet he told me with assurance that would baffle suspicion. I thought, if this dose of Spigelia will cure her, I will try it. Meaning he would try the system. He would try homeopathy in his practice. I went to see the young lady. I put the powder on the end of her tongue. I thought to myself it was a real piece of folly. But I told her I would come again in the afternoon. I was very busy, but told her I would go to the house at about 5 o'clock. Now you must recollect that this patient had not missed a spasm in 6 weeks. Her mother met me at the door. She was standing on the portico, and she raised her hand and said, Mary missed her pain today. Missed her pain? Had she any spasm? Not at all. Come in. I went in. The girl was sitting up. The first thing I did was feel her pulse. Well, Mary, how do you feel? She answered, I feel better than I have in a long time. I think it's because I missed the pain. Had you no symptom of it? No, she said. I never have had any premonition at all until it came like a needle sticking in my heart, but today I had nothing of it. I looked at the girl and I looked at myself. What conclusion could I come to? It must be the effect of the Spigelia. I waited until the morrow, and at 5 o'clock went to see the girl, who felt remarkably well. That night I went to see the doctor. Well, he said, did that powder have any effect upon that young woman? I said, really, I do not know how to answer that question. I called at 4 or 5 in the afternoon, and the girl had neither pain, spasm, or convulsion. And I called this afternoon, and she had neither the one or the other. Well, sir, you told me that if I would cure the case, and I have cured it with 1 dose of medicine, that you would believe in homeopathy. Well, doctor, if I tell you that I believe, you will say I'm a very visionary man. How could 1 dose cure that girl after I had done so much? How could 1 dose do it? He replied, the dose of Spigelia that I gave was what that girl's case required, and what you did amounted to nothing. So you can imagine if you were in practice and you saw that sort of thing, how very dramatic that would be. To have a case you've been struggling with like that, and then a homeopathic practitioner gives only 1 dose of medicine and sees it completely resolved. This is what I had happen early in my experience, and many others have had too. And it's one of the remarkable things about homeopathic practice. So I want to show you this mule case here. This is more contemporary, but it's a similar kind of a story in a way. This was a mule named Earl. He's a pack mule. He's 12 years old, and he'd been diagnosed as having a tumor. And you see a picture of it here on his leg that had been there for quite some time. His history was that he had developed this growth, or what was sometimes referred to as a blood blister, on his left forearm that had occurred the summer before. So it had been there for about a year's time. There was no known history of any cause as far as an injury. It was assumed to be a tumor. When the mule was presented to the veterinarian, the growth is the size of a golf ball, a tissue mass involving skin and connective tissue. The current treatment was topical DMSO, and the veterinarian had recommended removing it surgically. The mule was sensitive about this growth. It would not allow palpation or close exam of the area. He was taken out of his job and laid off from his job because of this condition, which is so painful for him. The first homeopathic treatment by the homeopath there, veterinarian, was thuya, 1M. This thuya is a plant from a plant called arbor, what is it called? I forget the name already. And it's used oftentimes for tumors, among other things. Not the only remedy for that, but it's one of those. And it's also used for effects of vaccination, which sometimes tumors follow vaccination, as we know. So that was given, but it had no effect. He continued to be the same. He tended to continue to be very protective of his leg. So the veterinarian brought this up to a forum. We have a group of veterinarians that have studied homeopathy that's online, and brought up the case, and we discussed it and suggested the possibility that it could be from an injury, even though that wasn't known to be. It's very possible during his job he'd been injured, kicked or fell or something. So we decided to treat it that way and see if it had an effect. So we used the remedy calendula. And 1M, again, both of 1M in both instances here, thuya and calendula, refer to the particular strength of the medicine, if you will. It's what we call a potency. So he received 1 dose of this. And 6 weeks later, you can see that it looks like it's starting to fill in. 1 month later, you can see that's hardly visible anymore on his leg. In 2.5 months, it was completely resolved. It had been there for over a year. And the calendula then had 1 dose only, one treatment, which is remarkable. I know it's hard to believe that that's even possible, but this is not unusual practice in homeopathy, is to give 1 dose. And the indications for it, it's from a flower, marigold flower, calendula, is for ragged wounds, to promote healthy granulation tissue, to stimulate healing without any side effects or infection. Also, one of the indications is that how painful it is, which this mule did show, how excessive pain would allow exam or touch of it. Just as examples, historically and also more in contemporary times, how if you were in practice struggling with a case and saw those kind of results, you know, you would be, it would strike you as really remarkable. I know that people will dismiss this. People will say it would have happened anyway. They'll say it wasn't the remedy, it was something else. It was just time, and so on. I've heard all of these things said. But you know, when you're doing this work, you see this on a regular basis. So you come to depend upon these kind of amazing responses. Not in every case, mind you, but certainly. Sorry, it'll stop here after 1 more ring. Not every case, of course, can be resolved, but just like any system of medicine. But nonetheless, in homeopathy, you come to expect that sometimes a single dose or maybe just a few doses in many cases will resolve it in a very frustrating situation. Okay, so let's go on and with our story of here of how homeopathy spread. And I've just covered the aspect of seeing in clinical work, seeing some rather amazing responses, which is one reason doctors would then develop interest in it. The other one was its effect during treatment of epidemics, which is again remarkable. So I'm going to talk about that in the remaining part here. There were, at the time, in the 1800s and into the 1900s, there were epidemics of diseases that were quite serious, quite threatening. Cholera, scarlet fever, smallpox, malaria, typhoid, all of these were serious illnesses with a high mortality. The treatment that was done with homeopathy led to people, as I say, turning to it with interest. By the 1880s, there were over 20 homeopathic medical colleges in the U.S., and every state had a homeopathic medical society. This is a picture of a monument that was built in honor of Dr. Hahnemann. That represents him sitting there on a chair looking thoughtful. This is a monument that's in Washington, D.C. I've actually seen it myself. It was established in 1900 by an act of Congress because there were so many people that were grateful to homeopathy for the results that it just was able to achieve during these severe epidemics that were so frightening to people. So people got together to honor him because they were so, as I said, grateful for it. This is quite large. It's at an intersection not far from the White House, Scott Circle, if any of you know Washington, D.C. And it was a gift from the American Institute of Homeopathy, and their location is given here on Massachusetts Avenue. You can see a close-up of Hahnemann sitting there. I don't know if he really dressed that way or not, but he lived back in the 1700s, 1800s. This is a back view of the monument. So I'm going to give you some statistics here. This particular one, we're going to discuss yellow fever epidemics. Yellow fever, at that time, it was not understood that it was spread by mosquitoes. And they didn't know what it was. They didn't understand the idea of a virus versus a bacteria and so on. What they knew was that epidemics would break out, usually around New Orleans, and then spread up the Mississippi Valley. So in 1853, at the Mississippi State Hospital in Natchez, the Allopaths treated those people that had yellow fever, and 55% of their patients died during that treatment. 2 homeopathic doctors in that same area treated 555 cases and had 33 deaths, which is a mortality rate of 6%. So you can see that that's really quite, it's not like a slight difference, but a very marked difference, 55% mortality versus 6% mortality. And of course that was noticed and seen by many. Between 1853 and 1878, there were about 6,500 cases of yellow fever treated with homeopathy in the greater New Orleans area. And the mortality rate was 5.5%. So that's remarkable. Almost 7,000 patients with yellow fever treated only with homeopathy and had a mortality rate of less than 6% compared to what the usual mortality rate was, which is, as we saw, quite high. Here's some details from the Great Yellow Fever epidemic of 1878. You can see over here on the map, here's New Orleans down here. And then I put circles around the 3 areas here that are being discussed over here on the text side of it. This severe epidemic started in New Orleans and spread up the valley, up the river. Greenville, which was here, Greenville had 299 deaths out of 1,100 cases. That's 27% mortality. Holly Springs, which is up here, had a 72% mortality rate among adults. You imagine 72%. That's like a death sentence. And then Port Gibson, I didn't find that one. I don't know where that is. Somewhere up in here. Had 275 deaths out of 1,500. That's 18% mortality. And Meridian over here had 86 deaths out of 382, a 23% mortality. The overall death rate for the city of New Orleans was 17% mortalities. And for the whole Mississippi Valley altogether, out of almost 16,000 deaths out of 74,000 cases of yellow fever, so 21% mortality. So you can see it varied from around the 20% range up to 72% range of mortality. This is under conventional treatment, medical treatment of the time. people were so understandably so afraid of it that you can imagine if it was coming to your town where you live now, and you knew it's possible that 1 out of 4 to maybe 3 out of 4 people would be dead in a couple of weeks. That's really quite frightening. So some of the things that these communities did is they would have people out there, guards with shotguns, to keep out strangers from the town. People would flee from the town when it started. Parents would even abandon their children. They would find children dead in the beds with their shoes on, left alone, unattended. We have published records of the treatment by homeopathic physicians. A lot of these records are from hospitals or organizations at the time. In New Orleans, the homeopathic physicians treated a little less than 2,000 cases with a mortality rate of 5.6%. In the rest of the South, they treated a little less than 2,000 cases with a mortality rate of 7.7%. So again, you can see how striking that is. Anywhere from 20 to 75% mortality versus around 6 or 7% mortality with homeopathy. In New Orleans, this might be a repeat here. Mortality rate of 6.6%. I think this is what I just said, isn't it? Yeah, sorry. I didn't realize it was repeating. So anyway, this difference in treatment outcome made a profound impression on both Congress and then the public itself, because the mortality rate was so much higher with the other forms of medical treatment. The Journal of the American Medical Association in 1902 estimated the allopathic mortality to be between 20 and 25%. So before we come to the next slide, so you can see why people were so grateful. They felt like homeopathy had brought something really wonderful in the face of these most terrifying epidemics. And this, what I'm giving you as examples, are not just the only epidemics in which homeopathy was successful. We don't have time to go into cholera and smallpox and so on, but it was the same difference in all the other epidemics, that homeopathy was much more successful in its outcome. Coming up to more contemporary times, just so you can see a comparison again, a treatment of pneumonia. The statistics for the year 2000, that pneumonia influenza was the 8th leading cause of death, according to the probably CDC is where this came from. Untreated lobar pneumonia has a mortality rate of 30%. That's really pretty much current. You know, I mean, I know it's 2015, but it's not going to change that much. So untreated lobar pneumonia has this high mortality rate. Antibiotics help some, but even with those, in persons over the age 12, the mortality rate's at least 18%. That's the way it is these days. And the mortality rate for community-acquired pneumonia is on average 12%. Hospital-acquired pneumonia is more severe, 50 to 70% mortality. We compare that back in 1928, before there were antibiotics available. Homeopathic physicians treated 11,500 cases of pneumonia only with homeopathy, with a mortality rate of 2.8%. This is documented information. So you can see how markedly different it is if we compare the mortality rates. Well, having said this, you know, and I realize that, you know, you could hear all sorts of arguments about why this information I gave you wasn't correct, or it was exaggerated, and all these other things that people will say. But if we assume that what I'm reporting to you here is accurate, that this is really the way it was, then you'd ask, well, why did homeopathy decline? One of the criticisms you hear sometimes is, if it was so wonderful, why didn't it continue to be used in this country? It's a reasonable question. Well, it's complex, just like anything, you know, that occurs on a political, social level. Here are some of the things that I think were factors. One is that the quality of homeopathic education declined. There were doctors coming in to the schools that taught homeopathy that didn't accept all of the principles that underlay it and started using the medicines more like they were drugs. This was a continuing problem in the homeopathic world. There was conflict within the homeopathic profession itself. Some of the doctors felt the medicines had to be used in material dose. They didn't believe there was any effect from medicines that were more diluted. There were those kind of arguments. Another factor was that to do homeopathy requires actually quite a bit of study. You have to learn the system. It's not something you can pick up just in a very short time. You have to study, like any medical system, really over years to become very skilled at it. It also requires more time with the patient. You have to go into a lot more detail about the condition than you would if you were doing more of an allopathic approach. Another factor was the emergence of patent medicines, and patent medicines were formulas, formulas that were made available to doctors, which made it very easy to treat patients, because you could have like number 16 for diarrhea or number 24 for fever or whatever, and you could have these combination medicines. These are not homeopathic medicines, these are drugs or herbal formulas, and they could be on your shelf, and when the patient came in with this condition, you simply handed them the bottle. And so it made it very easy, and that's pretty much the way it is today with dispensed medications or over-the-counter medications. There was also the adoption of the germ theory, which turned people more towards the idea that it was caused by these organisms, and they wanted to find drugs that were effective against the organisms. There was new technology that was emerging, such as X-rays and laboratory tests and things that also made it possible to look into the patient more than before. And so this also redefined diseases in people's minds away from the homeopathic view. Anesthetics that were developed made it possible to do more surgery and therefore remove disease products and disease lesions. There was also political conflict, which was probably one of the biggest factors, and economic factors. The economic factors were that the homeopathic doctors had to spend more time with their patient. Today, it's not unusual that the first appointment with a person, if you're an MD treating human beings, the first appointment might be 2 hours or more, and going over their entire history. Well, you can see, compared to today's medicine, where you have maybe 8 minutes or something, with a doctor, you make less money basically. So that certainly was a factor. Let's talk a little bit more about the political part, because I think you should understand this, because this was probably the turning point. In 1844, one of the important figures in homeopathy is a fellow named Constantine Hering. He came from Germany, and he was very active in the homeopathic community, and also as an author. If you study homeopathy, you run into him quite a bit because he produced some major works. In 1844, he founded the American Institute of Homeopathy, and this was the first national medical association in the country. The other doctors that were not homeopaths, remember I showed you that the numbers of homeopaths were not very large, but they tended to have the better quality patients, if you will, clients. So the other doctors that didn't like this and didn't like homeopathy got together in 1847 and formed the American Medical Association. And they primarily formed to fight homeopathy. They even had a consultation clause which forbade working with homeopathic doctors. For example, homeopathic doctors serving in the Civil War were not allowed access to hospitals, and they were not allowed to treat a patient another doctor was treating. That was the attitude then. That was the type of fighting that was going on for decades. Well, I won't go into more detail about it, except to say that part of what happened was that the homeopathy schools lost their funding because of this fighting between the AMA and the other organizations. And so the schools started closing, and by 1930 there was only one homeopathic school still in operation. In 1959, the last homeopathic school closed, and only 75 practicing homeopathic physicians were left in this country. So, you know, it was obviously it was not able to, shall we say, compete successfully with the allopathic. Okay, so it did though start to develop again, and we'll say that the resurgence of homeopathy, probably one of the major times was years was 1974. There's a fellow named George Vatholkas from Greece who started visiting the United States and teaching classes. And this developed, a lot of doctors became interested in it at that time and began to use it to at least some extent in their practices. And also they formed an organization called the National Center for Homeopathy. 1978 rather, they founded the International Foundation for Homeopathy. So you see, basically new organizations were forming. 1980s, various teachers began to enter the United States, and one of whom was Francisco Aziaga from Argentina, Pierre Schmidt of Switzerland, Bill Gray, Roger Morris in California, and other people like that. So these are not names you know, but these are some of the figures that were important in bringing homeopathy back up into a field of interest for us. As far as the veterinary homeopathy is concerned, there were some veterinarians that were using it, but not very many. I don't really know how many. I'm going to say probably not more than a handful, if that many at the time. And I began to study it myself back in the 70s. I went over that last time, some of my interest in that. And I didn't really think in terms of it developing into anything of significance. I was just interested in it, and I enjoyed learning about it, learning about a different view of health and illness and so on. And so I began to use it in my practice, and then as a result of that, people heard of what I was doing. I was asked to speak at a conference and so on. So anyway, eventually, I was asked to teach some of this to other veterinarians. And so in 1985, I did my first seminar for veterinarians on this topic. In 1992, we began the professional course in veterinary homeopathy, which is a year-long course. And in 1995, we founded the Academy of Veterinary Homeopathy, which is the first professional veterinary homeopathic medical association in the U.S. In 2013, we established then what we're calling the Pitcairn Institute. A little embarrassing to put my name on it, but the teaching program has been handed over to a group of faculty, and they wanted to call it that because they thought my name would bring people to it. By 2014, almost 500 veterinarians have graduated from this course. It's a year-long course, as I said. The next one is September 2015, if you're interested. It's going to be the 17th course, and it's going to be in Portland, Oregon. There are 5 meetings, and here are the dates if you're interested, again, just to see what's possible. Each meeting lasts 4 days, and there is homework and study assignment in between, of course, and there's a forum that you participate in. The director now is Sarah Stieg. She's in England. She went through the program, went to England to study homeopathy and opened up a house call practice there. I have the contact information for if you, again, want to follow up on this. I realize not everybody's going to be interested in it, but if you are, this is the program to look at. Okay, so